the state of our mouths is nothing to smile about. In the United Kingdom, roughly 27 million adults have at least one missing tooth. In a recent survey of 2,000 adults, it was shown that 3% of people with missing teeth said it led to them feeling depressed and socially isolated.
Traditionally, dentists have filled gaps with bridges or dentures. A bridge involves drilling the teeth either side into small pegs. This is of course very destructive and not particularly healthy for the teeth either side of a gap. Dentures or false teeth are usually made out of plastic and need to be taken out at night and kept in a jar of water. More and more of our patients who are rejecting the idea of having their teeth drilled down into small pegs or having to wear false plastic teeth are asking us for dental implants now. A dental implant, it's a titanium screw that's inserted into the jawbone, and that's used to replace a missing tooth root. Eventually, once it's healed, we can place a crown onto it, and that can give the patient a permanent, fixed, new artificial tooth, which looks as good as a natural one. But there's a big problem. Dentists are not taught how to carry out implant surgery at dental school whilst they undergo their initial training.
Today, we'll be following a group of dentists on the last day of their training course. These dentists have already been attending an intensive programme of lectures for the last year at Churchill College in the University of Cambridge, where they've been learning about the science of dental implantology. The day starts with a course director paying an early morning visit to his local village butcher. Dr. Millhouse, the surgical skills director, uses the pig's jaws to teach the dentists new surgical techniques. The bone and gums of a pig are remarkably similar in size and feel to humans. Dentist Dr. Richard Nichols will soon be putting his newly acquired surgical training to use after this exercise when he treats his first ever implant patient.
Practicing on the pig jaw is very useful. It's a great resource because it means that we can sort of do all the surgery, practice it all before we do it on a patient on something that's so realistic. It's very, very close to a human jaw. But obviously if anything goes wrong then there's no problem at all, so it's really useful.
Today we're going to be carrying out flapless surgery on a patient. This means that we've already performed the surgery on a computer using 3D virtual imagery, and we've made a digital surgical guide. So what Richard will be doing is fitting this surgical guide onto the patient's teeth, drilling through it, and then placing the implant through it, and that will mean he can place the implant in the patient's jaw in exactly the same place and the same angulation and position he's placed it on the computer.
The patient sits in the waiting room whilst the final surgery planning is concluded.
I'm fine with the surgery. I've had it all explained to me and I understand what's about to happen, so that's fine. It's good.
Before the operation starts, the operating room is sterilised and all the surgical instruments set out ready for the day's surgery. The surgeons don their sterile gowns and the patient's covered with a sterile drape. Any exposed skin is sterilised with liquid iodine.
During the surgery, I am going to be placing an implant on an upper front tooth. So we're going to do flapless surgery. We don't need to raise any gum up, or there's barely any bleeding. There'll be barely any pain afterwards, hopefully, for the patient. We've got a stent that fits over the top of the patient's teeth, and then it accurately points me where I need to prepare the hole into the patient's jaw and then place the implant.
Under the watchful eye of the course director, Richard starts drilling for his first implant case through the surgical guide. The first drill that he uses is a 2mm pilot drill, which drills an initial channel to remove a central core of bone through the upper jaw.
So we just make sure it's down against these teeth either side, so we know it's down. Well, it's exactly what you did there before. Absolutely right. Yeah.
Richard finishes off with a drill which is the exact size of the implant that he's going to place.
Is that sore?
Lastly, the titanium implant is placed onto a special holder which delivers it into the exact position that they previously planned on the computer simulation.
Foot to the floor. Now it's engaging the part there.
Yeah.
4 mil to go. That's it. What I'm going to do now is just have a look.
A special instrument is used to measure the tightness that the implant has managed to achieve, which shows the surgeons how dense the bone is. The denser the bone, the more chance we have of a successful healing.
Which means you've got a top excessive. Good. And once that's fully loose, I'll take this away from you. Keep the throat guard in, because what you're going to do now is see if sometimes it's come off. Yeah, that's fine.
Drill guide is removed and a healing cap placed onto the top of the implant, over which the patient will wear a denture whilst we wait 6 months for the implant to fuse with his bone.
Man tight. You done? Finish?
I felt it went really well. I was very pleased with the results. I think Mr. Russell was also quite pleased with the fact it wasn't quite as big a surgery as he was expecting, and it went very smoothly, so I'm really pleased with how it went.